So we're moving on to segment 4. Segment 4 is about theory and really about adapting maybe a particular theory to what we call affirmative approaches. I'm going to try to apply this to, once again, a clinical case and use video as far as demonstration about how this might look. So we're going to spend that time for segment 4. Segment 4 may be a little bit shorter. You spent a lot more time in your previous segments. I've done a lot of talking. You know, I keep saying I'm trying to pull away from that. So I'm going to continue to try to pull away from that a little bit by a little bit and get you thinking and processing on your own a bit more. Some of the additional resources that you will need for segment 4 is that you're going to see that there are 2 more scenes that we've video recorded. Video scene 2A and video scene 2B. Once again, these are actors acting out an amalgamation of actual stories in history from several gay men, and you'll find that actually I'm probably going to be a bit more directive, and I found myself being a lot more active than I usually am. But what I was trying to do is actually show some things in a brief segment so that you could actually see what some of these approaches may look like. Do I cover everything in an affirmative approach? Do I cover everything from my theory? I absolutely do not. But of course, we wouldn't do that in any given session. We do components. We bring out different pieces. I certainly try to represent in these films, in these segments, a bit of theory, a bit of application of affirmative approaches, and I certainly try to give you some things to think about and how you might apply this to your own theory and your own approach. So this is a good time to actually pause the presentation and watch scene 2A. What you're going to find is basically we're starting off, it's the same character that met with my female clinician friend. Same character, but we're going to treat it as if he has not gone to see her. He's starting off with the same issues, coming to see a therapist with the same confusion that he started off with as if he never went there. So I just want to show you how I might do things differently, personally, when someone comes in and introduces the concept of feeling confused and unsure about their sexual orientation, and trying to be open, affirmative, and create a space where I allow the client to guide me.